Good morning and welcome to another edition of United Way for Southeastern Michigan's What's the Word Wednesdays. My name is Audrey Walker, and today we are talking about mental health, equity, and services. Mental health services are critical to serving households and advancing equity in our communities. As a reminder, we'll reserve the last 10 minutes of today's conversation for questions. So please put your questions in the chat box if you're watching us on Zoom, or in the comments section if you're watching on Facebook. We're joined today by Dr. Shama Faheem, the Chief Medical Officer at Detroit Wayne Integrated Health Network, an organization committed to supporting and serving individuals with serious mental illness, children with serious emotional disturbance, people with autism, individuals with intellectual and development disabilities, and those with substance use disorder. Dr. Faheem is a board certified child, adolescent, and adult psychiatrist. She is also board certified in community and public psychiatry. She joined DWIHN in March of 2021. And before working there, she worked at St. Joseph Mercy Hospital in Ann Arbor as the medical director of their inpatient psychiatric unit, consult liaison service, and emergency psychiatric access. She has also served as the president of the Psychiatric Executive Committee and Education Officer. Throughout her career, Dr. Faheem has participated in several quality improvement initiatives and published in periodicals such as the Curious Journal of Medical Science and Strengthening Behavioral Services through partnerships and data integration in May 2022. So we are so excited. Thank you so much for joining us, Dr. Faheem, and sharing more about your work to discuss mental health equity.
Thank you so much, Audrey, for this introduction. I will start sharing my slides. Let me know if it's working out okay. And all right, so is it in the share mode, the correct mode? Looks great. Okay, all right. All right, so when we are talking about mental health equity and healthcare disparities go hand in hand. What we want is behavioral health equity. What we want to address is behavioral health as well as overall healthcare disparities. So starting with what behavioral health equity is. Behavioral health equity is the right to access quality health care for all populations, regardless of their race, ethnicity, gender, socioeconomic status, sexual orientation, or their location. This includes access to prevention, treatment, and recovery services for mental and substance use disorders. Now, the data shows that racial and ethnic minority groups throughout the United States experience higher rates of illness and death across a wide range of health conditions, both physical and behavioral. The life expectancy of non-Hispanic Black Americans is 4 years lower than that of white Americans. All these disparities became more evident during pandemic when we figured out that COVID-19 and its impact was also disproportionate, and racial and ethnic minority population basically had poor outcomes. The negative mental health impacts of the pandemic were also more strongly experienced by African American, Hispanic, and Asian populations, and there are multiple surveys that were that highlighted this disparity. Not only that, drug overdose deaths were disproportionately increased for the minorities during pandemic. As you can see in this diagram, 18-fold increase in mortality for Blacks and 12-fold increase in mortality for Hispanics, 9-fold in general for whites. So coming back to disparities in behavioral health, why these are systemic and these are complex. 1 out of 3 African Americans who need mental health care receive it. Asian Americans, Pacific Islanders are least likely to seek mental health, sometimes 3 times less likely to access mental health services. Minority population reports experiencing mental health problems at the same rate. So often what we would find is that the rate of the disease is the same, but their consequences are more severe or long-lasting or persistent. We also know that LGBTQ population are more than twice as likely to have a mental health disorder and often do not receive care because of stigma or discrimination. And there is a big lag in them delaying necessary care. Again, people from racial and ethnic minority group are less likely to receive mental health care. For an example, in 2015, among adults with mental illness, only 48% of whites received mental health services compared to 31% Black and Hispanics and 22% Asians. And again, as I mentioned earlier, sometimes the rates are either lower or same for depression, for instance, but it's again more persistent. Compared to the rest of the population, African Americans are also less likely to be offered either evidence-based medication therapy or psychotherapy. And I've cited the resources for these at the slides. If you ever need the slides at the end, I can definitely share them. Adults identifying as 2 or more races, whites and American Indians, are more likely to receive outpatient mental health and more likely to use prescription services, while inpatient mental health services were used more frequently by African American adults or those with 2 or more races. And again, African American with mental health conditions are more likely to be diagnosed with schizophrenia, bipolar, and psychosis. And again, they're more likely to be incarcerated than people of other races. Racial and ethnic minority youth as well are more readily referred to juvenile justice system than to specialty primary care or behavioral health care. So what leads to the disparities? And again, these are systemic factors, what we call as social determinants of health, cultural stigma, discrimination, overall lack of awareness, unequal distribution of money, power, resources, provider bias in treatment sometimes, as well as a lack of cultural understanding by healthcare providers that can sometimes contribute to either underdiagnosis, misdiagnosis, and I think language barriers sometimes also plays a role in certain minority groups. So again, public health, all healthcare, and especially public healthcare, has a special role and responsibility to address these factors, and addressing communities' well-being requires a very comprehensive approach. To promote mental health, public health entities such as Detroit Wayne find ways to prevent behavioral health disorders, improve access to mental health services, support recovery, lower the rate of death, disease, and disability among those with mental illness, and to increase awareness of mental health issues, reducing stigma, so people are able to access treatment when they need it, when they want it, and where they need it. So going on to give you a little background on Detroit Wayne Integrated Health Network, often referred as DWIN. We're always here to help and to talk. We are a PIHP, which is responsible for delivering of services to Detroit and Wayne County. And currently, we have been serving approximately 75,000 children and adults with serious mental illness, autism, individuals with intellectual and developmental disability, and children with serious emotional disturbances. If you go on our website, you can find a free mental health checkup. That's a free anonymous online mental health screening that would give you some potential risk factors, potential diagnosis to consider, and then links to resources as well as access to our numbers. If you have questions about COVID-19, we have also created a separate link and email called Ask the Doc at DVIN, where I receive those questions and we try to address it for our members, for our providers and community. As I mentioned, I have listed our website here, www.dwihn, and you can find some very useful resources there. DVIN services are family-centered, youth-guided, culturally and linguistically responsive, and trauma-informed. This is a barcode that would lead you to a good page that lists some of those services. Again, we have several departments. The most important one is the Access and Crisis Services. It is 24/7. I have shared the number. Again, we are available. We have experts who answer those calls, do mental health screenings, from 8 a.m. to 8 p.m. You get all the detailed screenings. For substance use, it's 24/7. You'd still get somebody to answer the 24/7 call who do preliminary screenings, help you connect with services. If there's a crisis, you get a warm transfer to the crisis call center, the crisis line, who address any crisis and then divert you to the important resources, whether it's emergency, whether it's mobile services, or whether if they can help you on the call to resolve some of the problems, solve some of the crisis. We have a customer service unit who actually is very active in member engagement. We have our members have a say where they're involved, and they have formed a group called Constituent Voice. So they're very active in giving us suggestions, doing outreach for Detroit Wayne and for mental health. We have a clinical practice improvement department that's constantly looking at new evidence bases, policies, procedures, trainings, and we offer we have a large group of providers, and we offer all sorts of trainings. Again, we serve people with depression, anxiety, psychosis, schizophrenia, bipolar disorder, intellectual developmental disabilities. I have listed some of the benefits that are included with IDD, with children's services, and with autism services. We are able to provide ABA for anyone up to age 21. Again, our substance use department focuses on both treatment and recovery as well, and we have a big component of Narcan training and distribution. I just want to touch very quickly and scroll through some of our major initiatives as we'll approach quickly to the closing time. So right now, Detroit Wayne is focusing on putting children first. For this whole year, we have done a lot in terms of making sure that we are addressing the need of our youth, especially because we noticed that the mental health and the emotional health of our youth deteriorated more so in pandemic. It was already, we were already in a crisis, but we know that all of that became more evident as we went through pandemic. So with our Putting Children First initiative, we have tried to figure out improving access, improving treatment, addressing crisis, wait times in the emergency department, as well as other community activities for our youth. We are extremely excited to do the groundbreaking last month for our clinical care crisis center, which would be a 39 bed unit and would have adult crisis stabilization, child crisis stabilization, adult crisis residential, and sober living units, which is extremely needed because currently a lot of people with mental health needs end up in emergency departments, sometimes have to wait for days and even weeks to be placed at those places where they need it. Again, this care center is just a start because we know the need is and the gaps are larger. This is just a start. I have entered some websites where you can find more details about these initiatives in case you are interested, and I'm going to share my slide set at the end. And I would just briefly touch on these three initiatives, which is opioid health home, behavioral health home, and certified community behavioral health clinics. All these initiatives have been evidence-based, and the basic theme is coordination of care. Detroit Wayne became part of Behavioral Health Home and Opiate Health Home last year, in collaboration with the state. We are the lead entity, and the whole goal is to address physical and behavioral health needs, integrate services, and provide a whole comprehensive package to the members who are enrolled in those services. And certified CCBHC, that is again an evidence-based, which goes by the no wrong door approach, where you can have any insurance in underinsured, uninsured, severe illness, and you just have to be served by those CCBHC. And right now there are multiple sites in Michigan and one in Wayne County through the state called the Guidance Center that we work with. We have a lot of projects and partnerships with City of Detroit and Detroit Police Department, where we have co-response, where Detroit Wayne clinicians are riding along with our police departments. They're helping triage the mental health calls, and I have included some of those information again in these slides. We are actually gold certified CIT program, so we have been training police officers in multiple areas within Wayne County for behavioral health first aid and behavioral health training in terms of how to address mental health needs when they receive 911 calls. We have a school success initiative program, where we are able to actually provide a 3-tiered approach in terms of identifying the mental health needs of youth, both in terms of prevention and treatment early on, so they don't get to the level where we can address them early on. We are in 72 schools, and we have 11 providers who are currently helping us with this School Success Initiative program. And the last one I wanted to mention is Detroit COVID-19 Virtual Therapy Collaborative. This is a program that quickly got launched during pandemic, when we realized that there was a lot of stigma and barriers to treatment. And there were, again, as we saw, the rising rates of depression and youth, and that where there was more disparity in African-American male single parents, transitional age youth were feeling more hopeless and isolated. So this was a line that was created to help them for a period of like 3 to 12 sessions. And the only requirement they had was minimum age of 14 and up. Children and families must have internet access and feel comfortable receiving services through video and online platform. We still have that. You can call or text this 24/7 helpline at 313-488-HOPE, or you can contact Detroit Wayne at our 24/7 access number 1-800-241-4949. And that is end of my presentation, and I can take any questions at this point. And
Great. Well, thank you so much for sharing more about your work. We're definitely going to move into some questions. And just a reminder, if you do have a question, please put it in the chat box on Zoom or the comments on Facebook. So one of the things, I know you went over a lot of the services and resources that your organization provides. Why do you think it's important for community members to learn more about mental health and mental health equity?
I think it's extremely important. The awareness piece, I still think that we are at a much better spot than we were before, and there is a lot of awareness, but again, there are still researches that indicate that the stigma is still there. So the more we work on the awareness and outreach portion of it, the better we'll be able to address that. So yes, it's extremely important. Coming to the second part on the equity piece. Now, I think it is very important because we just have enough evidence to indicate that there are just disparities at every level. They are systemic at this point. So we have to take all possible steps to address it. And did I hear you asking how, or this was just your question in terms of the importance?
Yeah, just more about the importance and just why, there's been a lot more, um, we're hearing a lot more about the importance of mental health, but just wanted to shine a light on maybe someone's that why is it really important, especially the equity piece. And I know you mentioned that there and shared some information about a free mental health checkup screening. So can you just walk us through what that might look and feel like, and then what some of the follow-up steps might look and feel like from that?
Right. So if you go to our website, it's actually right on the front of the website. The first thing you'll see on the top, if you click on it, it would ask you some basic questions in terms of screening. So you'll find multiple screenings actually. So there'll be some broad overview of those screenings indicating whether you are looking for substance use screening, or you are looking for just an overall well-being screening. Are you looking for depression? So it'll give you some multiple pathways, as well as an overall screening that can just pick information. And again, it's not meant for making a diagnosis without basically getting seen, but it's more like a screener for you to identify that, yes, there seems to be something that is concerning and it's time to reach out. As you move on to the questions, it'll ask you some questions about how you're feeling, how much you exercise, if you're talking about well-being. And then at the end, it would give you some of the numbers, whether if it's our crisis number, our access number. We also have a tool called My Strength, which is a well-being tool, and that information is also on our website. That is an app, and we have information on the login and password information for My Strength, and that can help you with an overall, again, so for the screening, if you figure out, no, it's not just, you're just feeling stressed and you want to address your overall well-being, that tool, My Strength, would be very helpful, because that can address some of your goals in terms of exercise, healthy eating, and you get guidance and resources through that. So that could be a good tool as well.
Great. And that's very helpful, because I know sometimes people don't know what to expect, or they might be apprehensive. As you mentioned, there is still a little bit of a stigma around seeking out resources. And so, so you'll take a screening, you'll find some resources, and then you give those a call. And then you'll go through certain steps on calls. Is there any specific information that people are asked for when they're
So this is anonymous.
connecting?
No, this is anonymous. So basically, I think again, we're working on advancement of certain apps for our community, where actually they'll be able to connect to a live person, like right then. But at this point, it is more like anonymous. You don't get your details in. So at the end, you'll get some resources to address certain things, like educational resources, plus the numbers to call depending on what your screening indicates.
And can you share with us the physical locations? I know you mentioned you recently had a groundbreaking, but I wasn't sure if there were other physical locations within Detroit or Wayne County that people can go to.
So again, we have multiple providers. So we have like within Detroit Wayne network, we have providers in all multiple cities of Wayne County. So they definitely have their own different locations. Our central office is on 707 Milwaukee Avenue. Right now, that is actually under construction because of because of using that location for our crisis center, and we are going to move our administrative office to a building at Woodward Avenue. So some changes going on right now, but definitely you call our number and they can find the closest location to you, because we have just a very large pool of providers within Wayne County.
And how are mental health providers engaging equity and inclusion into their work, either public or professional providers engaging in that?
Yeah, that's a very good question. And because again, we talk about it now that it's time for implementation. So what are you doing to make sure you're addressing those disparities, the biases that we talk about all the time? Again, as an entity, as a PIHP, we are trying to make sure that we set examples for that. And for that purpose, we have started several initiatives. One is hiring of a diversity and inclusion officer who would not only look at those disparities and equity things within our administration, but then move on to our entire provider network to look for opportunities of improving assessing, looking at data in terms of where the disparities exist. At state level, they're trying to do that too. Usually, all PIHPs have to go through a 3-year cycle of identifying a performance improvement project. And this year, like last year, the state identified that the 3-year project would be on addressing and narrowing any existing disparities. So we had to look for data within our entire system to identify those gaps and to come up with a performance improvement project. And that was true for all regional PIHPs over the state. So I think several initiatives are going on. And for clinicians, I think just the implementation of implicit bias training, which becomes required now, I think is also a step which kind of moves the providers of care in that direction where they have that awareness. So some focus on trainings, focus on accessing data, doing your internal dip, and coming up with performance improvement projects to address and narrow those gaps.
Great. And I just have one more question for you. I just wanted to ask you if, what is one thing we all should think about or know when we're talking about, mental health, behavioral health equity or mental health equity? What's something that you want everyone to take away from this?
I think to me, the biggest thing is empathy. If you think about empathy and put yourself in the shoes, we would be able to narrow that gap very quickly. I think some of those things exist because of our unconscious bias and us not being able to put ourselves in those shoes and figure out how that person might be feeling, what social determinants are contributing to their factors. So I think if you have that strong sense of empathy, and you are mindful of those very sensitive things that people face, the trauma experiences they have, then we'll be able to address stigma, disparities, a lot of those things.
Thank you so much. Really appreciate you sharing your point of view and all this wonderful information with us today on mental health equity and services available. We've shared a lot of great information in the chat as well, along with the website for the Detroit Wayne Integrated Health Network and their 24-hour helpline, 1-800-241-4949. So we've got a few more updates to share with you before we close out today's What's the Word Wednesday here. So as a reminder for anyone in our community who may be experiencing need, our 211 helpline remains available 24 hours a day, 7 days a week. And this includes resources like cooling centers, many of which are open this week. We'll drop a link to help you find your nearest cooling center. We always maintain a running list of partners and services in the community that we can connect you to for the support that you need. You can also look up resources in your area by using our 211 resource database at unitedwaysem.org/211. And we've got our next town hall coming up. If you can join us next week, or we'll return on August 3rd to discuss behavioral health services for youth and families. You can visit unitedwaysem.org /virtual town halls to stay updated on our upcoming topics and to also watch replays of our previous town halls. There's a lot of good information shared there. The website is also included in our chat box. So we thank you so much, everyone. Stay healthy, stay safe, and please continue to live united.